This is part 2 of the PowerPoint training, and this section covers a lot of information about creating a culture of safety, setting the stage for an effective debriefing, different ways of establishing trust, building student self-confidence, and it also defines the fiction contract. Just a couple of things on culture of safety and simulation. There's a lot in the literature about creating a culture of safety in simulation debriefing, and these are just a few of the highlights. I think one of the biggest things is allowing the students the opportunity to practice the individual skills before they come to simulation. Simulation is applied, and this is not where they should be doing something for the first time. They should have had the opportunity to practice that before they get to simulation. We should assume that all students come to simulation having prepared and with a positive learning attitude. It's important that they're oriented to simulation, to the learning environment, and to the debriefing process before the simulation begins. You can do that with a video. We have a video that we post for them, but we also allow them hands-on time in the lab to orient to where everything is. I've seen literature for both sides of this, considering to having an instructor other than the clinical instructor facilitate the debriefing. The rationale behind that is that the clinical instructor has control over the student's grade, so that might make them a little bit more intimidative. The other side of that argument is that, you know, if the clinical instructor gets to know the student very well and has an idea of what the student's strengths are, then they can really help them in clinical. So I think basically it comes down to a lot of who you have available to conduct the debriefing. So we are training all of our clinical faculty who are doing debriefing also, you know, to have this PowerPoint. And, you know, I think if you have I think the big thing is having a trusting relationship with your student, regardless of whether you are their clinical instructor or not. The next 2 slides give some ideas for ways to improve the student's self-confidence. And I think, you know, what I would say if I were mentoring somebody, in debriefing, I would say, think about yourself. What are the ways that you feel more self-confidence? You feel self-confident when someone emphasizes your successes and not your failures. You feel self-confident when someone looks at your failures not as mistakes, but as, you know, but tries to get to the reason behind the failure. You know, what got in your way? Was it anxiety? Was it fear? You know, why did you not understand this concept? Was it something that you didn't understand in the reading in the didactic course? In trying to unravel the failure, not seeing it as a mistake, but just as an opportunity to explore thinking, not comparing people with their peers. And just think about for yourself, what makes you feel more self-confident? And those are the same things that you can do for your students. I think one of the most important things that you can do in debriefing is to observe your students. We're all nurses and we assess people all the time. So when you're watching your student in debriefing, what is their body language telling you? Are they sitting there with their legs crossed and their arms crossed? Are they making eye contact or not? How are they reacting to the people around them? Are they joining the circle? Are they resistant to joining the circle? There's so many things that you can look at in terms of their nonverbal communication that will tell you whether or not they feel safe. And so when you're in debriefing, that should be a big focus for you as the faculty, is observing the student. The number one thing that I would say in debriefing is listen to them. Listen to your student and try to decipher from what they are saying, what do they need? Being considerate of each student, of course, exhibiting patience, because they can be struggling with a concept and you know the answer. And maybe your inkling is to give them the answer, but allow them to struggle through that. Allow them to discover that on their own, because the discovery will be very important for them. And then asking appropriate questions so that you're kind of pulling that information out of them.